Welcome, everyone, to Caregiver and Connection, our virtual wellness series we have going on this summer. On our second episode, we have Dr. Kapil Kapoor, who is chair of Retina at EVMS and co-founder of the Wagner Kapoor Institute. So welcome, Dr. Kapoor. He is going to guide us through the patient-caregiver relationship, honest conversations in medicine this evening.
Thank you so much, Wendy. Thank you for having me. I had a really good time doing the Sundays with Wendy podcast, so it's great to have this follow-up. Just as a summary, we're going to talk a little bit about how healthcare is changing and just frame that picture a little bit. And then I'm going to talk about a couple tools to empower patients and empower caregivers in the actual patient visit. And those tools are going to be the Amazon Brain, the Healthcare Huddle, and the ChatGPT Brain. So we're going to talk about that one by one. So first, I just want to paint the picture of how I think healthcare is changing. There was this recent analysis by the AMA, and for the first time this last year, more than 50% of doctors were not practicing in a private practice. And that data point really struck me. What does that mean? I think that means that doctors might be less in control of what's happening in that patient visit. And I think it speaks to the business side of medicine taking a little bit more of a front seat. And what does this translate to for a patient or caregivers? I think it translates to that patient visit possibly feeling a little more rushed, having a little bit less time. And I think it can add or contribute to a feeling of powerlessness for patients and for families or for caregivers. And my biggest message here today, if there's one takeaway, is that patients and caregivers are not powerless. You are totally empowered, and I'm going to share some tools that I think can help add to that. I'm very passionate about this. Wendy knows that I'm a Mayo Clinic alum. Their primary institutional value was the needs of the patient come first. And I feel very passionate about being a very active ambassador for excellent patient care, and I don't want to see that get lost even if healthcare is changing. So just know, patients, families, caregivers, no one can strip you of your power to get informed, and don't be afraid to dig deeper. Don't be afraid to ask questions. I think you'll find if you pause and ask questions that most doctors welcome it. I think there's also a little bit of a mindset on how to go about asking those questions. So let me introduce this concept of the Amazon Brain. Okay, and I think this is a great way for us to think about asking questions in the doctor visit. You know, I define an Amazon Brain mindset as gathering resources, fact-finding, and doing research to make an enlightened healthcare choice. So we are used to doing this all the time with choices that, in my mind, are a lot less trivial. So our family makes Amazon choices literally every week. So, you know, the decision that came about in our family this week, my 9 and 10-year-old children who started Kumon for the summer this last week had to buy an iPad pen for their Kumon class for their iPads. And they both got home from the first day of Kumon, and they researched online which iPad pen they want. And they all have a little bit of their allowance money, and they saw the real iPad pen costs, you know, whatever, $100. They can find this makeshift one that was $23. The reviews were 4.4 out of 5. The reliability was high, you know, and they get all this data, and they're 9 and 10 years old. And I think they quickly were able to make very informed decisions about whether or not it was worth it to get the cheaper one, how long it will last, how reliable it is. And I think that exact same mindset that we're so used to with things around the house or day to day, we don't necessarily carry forward to our healthcare visit. I think we are much more inclined to say, I was referred to this doctor and I'm going to go and talk to them about why my vision is blurry. And I think we can go through this exact same process. We should go through the same process and research online about what our symptoms are, what's going on, what could be helpful, what the treatments might be. Frequently give patients injections in their eyes for bleeding blood vessels from diabetic retinopathy or macular degeneration. And usually there's like a primary caregiver that always comes with mom and dad, and then there's a secondary caregiver that might come periodically. And sometimes, like this happened last week, the secondary caregiver came for their first visit, mom and dad, and they're not used to needles, they're not used to being in the healthcare space, they don't like blood, and they were getting very worked up about being in the room, watching dad get his first shot in the eye, and they were getting so squeamish, raising their voice. You can tell their heart rate was up. They stood up. And then that got dad really worked up about getting the shot in the eye, and he got tense. He's done it with me a dozen times. And then they start holding their breath, they get panicky, and then they feel more pain with the shot. And all that could have been avoided. What could have happened or should have happened? They should have had a mini healthcare huddle, and they should have said, Dad, that whole thing about cross my heart, hope to die, stick a needle in my, like, that really is not me. So I'm going to drive you there. I want to meet the doctor. I'm going to step outside the room when you get your shot, because I don't want to see dad in any discomfort or watch dad go through that. That little moment makes the whole thing a whole lot easier, for everybody. That's a small one that comes up frequently. Another one that came up a few weeks ago, I had a patient with earlier macular degeneration that was first diagnosed, not getting injections in her eye, came with her daughter, and mom had researched about macular degeneration a lot. Her primary concern was future impact on her. How much is this going to impact my future autonomy? How long will I be able to continue to drive on my own and live independently? And daughter was very concerned about, how genetic is this? How much is it going to impact the daughter in the future? What's her risk? Was somewhat in denial about the diagnosis because it was the first in the family, and really wanted to drill down on a cure, what the research is on cures. And the daughter was way more outspoken and took up the majority of our time. And at the very end, I kind of was able to get some time with mom, and I could tell that really was not on her mind. And it would have been much better. Honestly, I could tell mom was annoyed with her daughter that she took up all this time and talked about this. So it leads to a breakdown between the caregiver and the patient. It leads to some resentment, and that breakdown's avoidable. I think a healthcare huddle ahead of time, they could have chatted about what their goals were and what their concerns were. And I think mom could have easily or quickly relayed to her, well, daughter, I already researched all this. There's no cure. And I'm not worried about that at the moment. I really want to know, do I need to make plans to get an assisted living in a year or 2 or 3? Do I need to sell my car this summer or in 3 years? And I think they could have had a much better output there. And sometimes I'll see these things play out. I see many of these patients monthly or every 2 or 3 months. I'll see these things play out over time where I can tell the resentment is building within the relationship. The child is feeling like they're doing the best they can to be the caregiver they can, driving mom back and forth while she's dilated because she can't do it on her own, but still not addressing the needs that the patient actually has. I think there's a lot of fear and mistrust surrounding communicating about these things. And I would really encourage patients and caregivers to use this structure to help guide the time within the doctor's visit. And again, zooming out in the setting of healthcare is changing, time in the room with the doctor admittedly is shrinking, and this is just a way to get some of patients' power back. So a little bit of structure about how to structure this and structuring this healthcare huddle. A little mnemonic I like is PACT. So PACT stands for prepare, ask, collaborate, and trust. And so prepare is obvious, and these can be small. It doesn't have to be some big, sit down in a big family conference. It could be a Zoom, and there's often 2 or 3 people that are stakeholders in that discussion. It can be a spouse or multiple children, or a lot of times it's somebody who's gone through this before in the family that has the gene that wants to share their experience or their fears or their worries. So prepare is just discussing these things. Ask is asking each other, what are your worries or concerns? Or what have you read that you want to add into this? Or what are your experiences with others that have this? Collaborate. Let's make a plan on what our goals are and how we can move forward. And then trust, which I think is one of the most important ones, is really trust yourself as the patient and the caregiver. I think there are so many layers of fear for patients about the questions they ask. Questions like, I don't want this question to sound stupid, or I don't want my doctor to be annoyed the fact that I have this question, or my doctor clearly knows me better than I know myself, or my children know me better than I know myself, so I'm going to let them lead and guide this. And I think when patients trust their instinct, or trust themselves. Nobody knows the impact of their vision loss or their vision change on their activities of daily living more than themselves. And it's really their time to get those questions answered. And a lot of times I'll find it's not until a third or fourth visit with the patient, and a lot of times at a visit when I'm one-on-one with them and the caregiver is not there, that their real question comes out. And the question might be, do I need to stop drinking my hot coffee in the morning because I'm losing depth perception? I burned my fingers a couple times, and that's really what I'm worried about, you know? So it can be something that might feel trivial or feel small or feel not relevant, but it's your vision and it's your impact. And I think patients should really trust themselves. So again, PACT stands for prepare, ask, collaborate, trust. I love mnemonics, and I feel like it just helps everyone just like, let's just jump and make sure we got all these little points. So the next thing I want to talk about is ChatGPT Brain. And we talked about Amazon Brain, we talked about Healthcare Huddle with the PACT, and now ChatGPT Brain. I have been so impressed with how AI has come in to the healthcare space, the level of preparedness it adds for patients. You know, I'm sure many of us have played with ChatGPT, and if you put questions into ChatGPT, especially if you put open-ended questions, what should my concerns be about this surgery, or what are the success rates, or what are the new techniques? The amount of information that we have at our fingertips is amazing. And I think what I've seen in patient encounters with patients and with caregivers is so much fear. And I feel like the real questions come out when they're one-on-one, when caregiver's not around, and when they have no fear of, when they've gotten to know me better or known our practice better, their fear of how the question might be perceived goes away a little bit more. And I think ChatGPT helps with all of that. They're in front of a computer. ChatGPT is never going to say the question looks stupid, and the caregiver is not around. So you can really ask whatever you want. And I've seen this be helpful. I've seen this be successful in so many different ways for patients. So a very common example in my field is when somebody's retina detaches, the post-operative course can be very unique, and very commonly patients need to have a gas bubble surgically placed into their eye, and they very commonly need to put their head down for 7 to 10 days. And just the idea of that is so, you know, it's kind of almost unfathomable to so many patients that I think as soon as they hear that, there's kind of a long freeze and a pause, and they get so stuck in how am I going to do that? I can see the patient and caregiver sometimes just get so perplexed and kind of get almost in a fog. And as I'm trying to guide them through it, I can tell sometimes we're not retaining as much after they hear, they're visualizing themselves in this state of having their head down, and their mind is just racing on, how am I going to do this? But the pressure of, if I don't do it, I might not get my vision back. And in that loop, I can tell, you know, our retention is shrinking at that moment. And so very frequently, I will get rolling questions after that come as phone calls, or come as sometimes a follow-up visit again, or a phone call from another stakeholder in that patient's care, like, you know, a spouse or another child. And of course, all of that is welcome. But I've seen now with ChatGPT, some patients' level of preparedness is so high, they're getting so much more out of that visit. They've digested this moment of, I might need a gas bubble, need to hold my head down. I read this through ChatGPT, and my specific questions are, do I really need to spend the money to rent the FaceTime equipment that's offered through your practice? Or here's a picture of the massage table my neighbor has. Do you think this works? And would this, you know, be okay? Or I understand you can't travel with the gas bubble and go by air travel for sometimes a couple months. My daughter's wedding is in 6 weeks in California. This is my biggest concern about this. So let's, you know, hone in on that. And again, of course, in an ideal world, we as surgeons can be clairvoyant in that healthcare visit and elicit every detail. And, you know, obviously we have a checklist of all these different things I'll share with patients when they're getting a gas bubble, and that is pretty comprehensive. But again, in that moment when you're afraid that you're losing your vision, our attention span is very small. Our ability to retain that, it's just human nature. You know, a little bit of our panic goes on and visualizing it, I think, is scary. So ChatGPT has helped so many patients, I think, get more concrete information, make the most of that healthcare visit. And I think it's I love having those type of questions. I love the precision of that information. For me, I feel more confident that I'm giving my informed patient exactly the information they need. I'm addressing the specific questions that are going to be most critical to their success. Without face-down positioning, these surgeries might not work. And the things that are coming up regarding their worry about travel, or they have some different type of equipment, or they have a back issue that would prevent it, or a stomach ulcer if they're lying down, all these different things, if we can get really specific, I can usually guide them with an experience I've had with it and get past their fears around that question. So I want my patients to succeed, and better questions help both of us. So it's a huge win. So again, zooming out, I think as much as possible, and I know this can't be universal for everybody, especially for some of my patients that might have poor vision coming in, might not be able to do ChatGPT on their own. But as much as possible, I think zooming out, thinking about a healthcare visit with your Amazon brain. So we're very analytical about asking the right questions, using a healthcare huddle to get all the stakeholders really involved and getting everyone's thoughts and ideas through a pact so we get aligned. And then after all that, whatever questions or goals you've come up with, putting that through ChatGPT, I think will answer or refine many of the questions that will trigger more specific questions for you as a patient or as a caregiver that will help guide to more success. So just a couple more closing type of thoughts. Again, my background is Mayo Clinic. We feel very strong. Everyone felt very strongly. Patients come first. It's kind of one of those principles with the Hippocratic Oath that I think all physicians, all really healthcare givers want to maintain. And even if healthcare is changing and time is shrinking, patients should feel empowered. Caregivers should feel empowered. So I want them all to have that. These tools are a step in that direction.
Thank you so much, Dr. Kapoor, for sharing that wonderful information. I realized I didn't introduce myself at the beginning of this live, so briefly, I'm Dr. Sheetal Ajmani. I'm the medical advisor of the Benjamin Goldberg Foundation. I was a practicing pediatrician for over 16 years. And so I really appreciate the frameworks and how you broke it down you just broke it down in such a very accessible and approachable way. And I have, having practiced medicine for many years as well, and, sat in both seats, right? So as a healthcare professional, a physician, as a patient, as a caregiver, right? So having sat in all of those seats as well, I have so many reflections coming up as you were speaking. And so I wanted to just bring some of those up while we wait for questions. If anyone here is joining live, please leave a question in the chat. I'm going to kind of go on my reflections with Dr. Kapoor and Wendy here. And as those questions come in, we'll include those as well. And for anyone who is listening to this as a replay, please still leave your questions in the comments below, because we will do our best to respond to those. So, quick recap on those three aspects that you mentioned, really patients and caregivers feeling empowered and bringing these conversations into the clinical settings, right? The Amazon brain, healthcare huddle, and ChatGPT brain. And, your number one takeaway that you shared at the very beginning of this conversation was like, if there was one takeaway that you want people to get from this conversation, it is that patients and caregivers are not powerless. And I think that's so important. And that's exactly, I know, these tools that you're sharing with us are all about. And I think that's so important, because you're absolutely right. Particularly with a new diagnosis, with something that can feel like it carries a lot of uncertainty. It may be a change in way of life. In perhaps, a lot of the examples that you shared with patients that you see as well, perhaps affecting the levels of autonomy in terms of things that maybe they once were able to do, that whether for a period of time, at least, they may not be able to do in the same way. So a lot of that can make us feel quite powerless as the patient or caregiver. But knowing that there are still aspects that you have, and quite a few aspects that you can still feel empowered in the process of management, coming up with that management plan in cooperation with your physician, with the healthcare team. And part of that is, gathering those resources and really being an advocate for your own healthcare and the care of your loved ones, particularly as you mentioned in this day and age where, yes, where that business of medicine is kind of unfortunately taking a bit more of a front seat, where it's causing that limited time that we have with our patients. And I always share, Dr. Kapoor, as well, that I haven't met a single physician who doesn't want to spend time with their patients.
Exactly.
Like we all got into this field because we want to spend time with our patients. We want to help them feel better in their bodies, in their minds, in their emotions. And that's why we all got into this. This industry, this industry of serving. And so, if it seems like your doctor is rushed, they likely are. And it is likely more related to just the strain on the healthcare system as it is currently. But that does not mean that they don't want to hear from you. They still want to hear from you. They still want to make sure that they're addressing your concerns to the best of your ability. And some of the tools that you shared, Dr. Kapoor, can really help to optimize. And you said this a few times when you were sharing, is that it can really help to optimize that time together.
Right. Yeah, it's interesting. I think when you bring up pediatrics, like my wife's a children's dentist, and we talk about this energy a lot. I think, many of my patients are geriatric, and I think when you look at the geriatric population and the pediatric population, there's often a caregiver in both of those settings. And the caregiver, in the best interest, I think, often tries to come in as a guardian of the patient's healthcare. And there's an energy there. There's an energy, but you probably have seen this, Dr. Ajmani. A lot of times, your pediatric patient might be very small, might be very young, but might be very aware of what they're really worried about, what they're concerned about, and mom and dad might not be attuned to it. And these same tools apply. There's an energy with the guardian and the patient and then the provider. And it's not the best if all that plays out right in the doctor's visit. It's a little better if there's alignment before, so then the doctor or the caregiver can or the provider can address that appropriately. There's a lot of overlap in our fields.
Absolutely. Absolutely. And that's why I said there were just so many things that were coming to my own mind on multiple levels as you were sharing. And one of those, the word that came up for me when you were describing that specific aspect was emotional co-regulation, a term from psychology that, really we do emotionally co-regulate with the people around us as well. And so kind of like you described, we can pick up on that energy of others, caregivers or loved ones who are in the room with us. And, the example that I thought of from the pediatric perspective, because I practiced general pediatrics, neurodevelopment, as well as urgent care, is, things like vaccine administration. Understandably, many children are nervous about that, but sometimes some children aren't aware of what's going to happen, but the parents are already getting worked up well before, we come in there with the vaccines. And so, being aware and mindful of that emotional co-regulation, or another example from pediatrics where there may be two parent caregivers, or perhaps a parent and a grandparent caregiving for the child, right? And where maybe information hasn't been communicated clearly between them, where only one of those caregivers are coming into the visit, similarly to what you described, right? But again, so, slightly different age groups, populations, diagnoses that we have experience with, but it's these same dynamics that continue to play a role there. A couple other reflections that
I'll just add, when you say that, it brings up, I think their familiarity with the child and their needs, and everyone wanting to be a guardian, but different ages play a big role. And another thing is just their familiarity with the healthcare space. Like, some are very comfortable being in and out of doctors' offices. And we all know patients, that we all have friends like that. And some are very, very uncomfortable being anywhere in a building with a needle or anywhere in a building with blood. And that has its own big energy in that, in pediatrics for sure. And I see that same thing here as a big variable.
Yeah. Another thing that was coming up for me when you were sharing, specifically in the examples that you were giving of patients and caregivers you've seen in your clinic, was just this idea that realizing that caregivers and the patients themselves may have different things that are top of mind for for them and different worries and different concerns, and not assuming one or the other, for anyone involved in all of this, right? The physician, the caregiver, or the parent, right? We can't assume that, okay, this is what they must be concerned about because they're in this situation. It's we all individually have different concerns, worries, fears that come top of mind, particularly when maybe faced with a new diagnosis or a difficult diagnosis.
And I want to normalize that through this. Like, let's normalize that we have some different ideas or different goals or some different fears about it. And again, it's a very, very small example, but hopefully very relatable. All the stuff that we buy on Amazon, like almost every time our family buys something on Amazon, we discuss about it. Like, oh, well, I think that, like a vacuum or everything there. I will almost never have a family purchase Amazon that we're like, oh yeah, we're getting this and we all agree, done. It's just never that way. So why should we expect, instant alignment about such big, big things? And again, my thought is that it just comes from longstanding or historic trust of the healthcare space and the physician. And I appreciate that. And I take that responsibility seriously, as I know you do. But I think let's normalize that we could have different goals, and let's normalize that we all have access to a lot of data. Let's normalize that we should all trust ourselves. Like, patients really know themselves the very best. Coming from that Amazon brain or that hat of like, I'm a consumer of this healthcare, I trust myself and know myself, and my caregivers know me too, So I just want to normalize that. And I think you're saying the same thing.
Absolutely. Absolutely. And I love that final part of the pact, the T, trust yourself.
Yeah.
I always would share this with my patients, that
Really?
there's something to maternal instinct. If a family came in, and mom's like, I've done an evaluation. They're like, something still isn't sitting with me, right? It's like, let's follow that. Let's see kind of what that's right. Let's see what's under that. Is there something else that we need to do here? Because the fact is also that as physicians, we're human too. Yes, we have gone to a lot of school. We have done further training to specialize in our particular specialties, and we're also human. So really, like, you as patients and caregiver doing that research at home as well and bringing questions to us, honestly, it can give us a moment to also pause within kind of how rapid our days move, to also sometimes take even almost a second look or to think about things in a different way by the questions that you bring up to us.
I agree. I think maternal instinct is a great example of the trust we should place in our own knowledge. And I remember that from pediatric rotations. If mom says something, let's all pause because mom knows, and I think that's a great example of trust does not have to always belong in the physician. I don't think.
Yeah. Well, thank you again so much. I don't see any questions coming in quite yet, but they may come in afterwards too, because this has been such an engaging and helpful conversation that I know that many people will find great value out of.
Kapil, the tagline of this episode is called Honest Conversations in Medicine. So I think sometimes when a family member becomes ill, it's acute or very sudden. So, you're thrown into these things sometimes
Right.
without being able to prepare. So do you have any advice in those situations where maybe there isn't time to huddle?
Yeah. I would then just lean on trust yourself. Like,
Yeah.
I think so many patients in the moment hold back on what's really on their mind. And in those moments, as a provider, as a healthcare provider, you can kind of see or sense that there's an uneasiness still toward the end of your visit after you inform the patient. And then we are trying to elicit what's behind their uneasiness, and we might probe, do you have any other questions? Do you have any other concerns? And sometimes I think in that quietness, they're just scared about what's going to happen, or they don't know what to say, or they think their question is maybe silly, or they don't want to say it in front of the family member. And I would say just speak your mind, because first, your physician has heard that question before, I promise. And again, what Dr. Ajmani was saying, your healthcare provider really wants to help you, and really wants to be able to give you reassurance or give you guidance or help navigate that moment for you. And the other thing I would say is when things are acute, usually when you're in not usually, but sometimes when a patient's in the doctor's office or a caregiver is, um, there's a little bit of brain fog that sometimes comes up at that moment, just when you're hearing things, or there's a feeling that in the room with the physician, the time is really moving very quickly and then it's over. Um, and even if you don't have the time to research it or do anything, start writing down questions, and whenever you think of it, like even when you're in the car ride, not when you're actually driving, but when you're in the car ride, like, just taking some notes. I think that little thing helps a lot. And, I'm, I'm in medicine. My wife's a dentist, but when I take my children, I think everyone gets emotion about their children, anything healthcare with your children, you always get like, I still take notes because I know you can either get so focused on what the doc is saying or just kind of hear something and you get emotional about it and you lose your focus. So if you don't have time to prepare a lot, just write down what's on your mind so that you're sure whatever's on your mind, you're able to address. And I think that would be my one advice.
Yeah, I would love to, if it's okay, I would love to add, I love everything that you just shared, Dr. Kapoor. I would like to sort of add and build on some of that, if that's okay.
Of course.
Two things. One is, when you're kind of see your physician and you're faced with a new diagnosis, whether it's acute or whether it's something that may even be long-standing, but it's your first time hearing about the diagnosis, that news is you're first receiving that news, and it can be a bit of a shock to the system. And Dr. Kapoor, you alluded to this as well. Your nervous system can actually go into see that as go into a stress response,
right,
which makes it very difficult to think clearly because you're just sort of in this survival mechanism state, your nervous system, which can make it very hard for you to really think clearly, to compose questions, and to even think what do I want to ask? What do I need to ask right now? And so I think in those situations, another thing to keep in mind is that you can always, and you should be able to always also be able to reach your physician and or the clinical team in some way, shape, or form a little bit later, once you've had a chance to process some of that information, whether it's through a patient portal or leaving a message or scheduling a follow-up visit, right? And if this is something that needs ongoing follow-up, that follow-up will be already suggested by your
right,
physician and the clinical team anyways. And so knowing that it's never just like, okay, you didn't think of the question in that 10, 15-minute appointment, and so the chance is gone for you to ask it. That is generally not the case. Also, speaking from, someone who has similar, Dr. Kapoor, and correct me if I'm wrong, but from my experience, the amount of conditions, although it can feel very obviously significant or severe, the amount of conditions that are actually what we would classify or call emergent. So a few kind of definitions here, right? Emergent, meaning it emergent, acute, needs to be taken care of right away, versus urgent, where it is important, it is severe, it does need to be taken care of, but maybe not right away, like that day, versus more chronic or acute, which it needs to be addressed, but maybe you can wait a little bit longer, right? So the amount of situations that are actually emergent that absolutely you need to take that very next step right away is actually very few, right? And so knowing that you do have that time to ask those questions. So I wanted to mention that. And then also I loved what you shared about taking notes. And from my perspective, what I was thinking about was when I was practicing in pediatrics, I loved it when people came in with notes. I loved it when they came in and they had a chart of, okay, my baby had a fever. It was 102.1, 5 p.m. and, 2 days ago, right? And they have it all marked down. I love it when people come in with notes, So please don't feel shy about that. Please take those notes, in these days, you can jot it on a piece of paper. You can use the notes app in your form, and I'll share something else now not from the physician perspective, but as a patient and caregiver perspective, there's been situations in my own life where family members have been navigating particular, health issues. And we did do a healthcare huddle where it was a shared Google Doc, right? I mean, we would talk.
I love it.
Talk and have communication, but we also had a shared Google Doc. And it was like all of the information, all of the questions that are coming up for each family member, we're inputting it into this document so that it's accessible for whichever family member is in the office that day.
Yeah, I love it. So one of the things that came up for me when you were talking about stress response and emergent and urgent, and I think another thing that we have, probably overlapping in our fields with pediatrics and vision, everyone's emotional about their children and everyone's emotional about their vision. And things that might not be super emergent will feel emergent just because there's so much emotion surrounding our children and our vision, and I think it leads to that kind of panic and stress response. So just this structure and notes helps a bunch. Um, and sometimes the stress response gets amplified because you might just be on your way over to the doc, you put into Google, and it talks about some 1%, scenario that you read about that this leads to blindness XYZ. And then you turn your phone off and you're even more stressed. So I think structure like this and notes and discussions and huddles help break down that stress response, which is really what you need. Break down the stress response so we can guide you. And just like you said, I love it when everyone comes in with questions. I want to be able to help them, and the more organized their concerns are, the more confidently I can address them, and help navigate that journey with them.
Yeah, absolutely. And that brought to what you just shared, that brought to mind in another idea, another thought, another suggestion that could be helpful if someone as a patient or caregiver has that awareness in that moment. If you do have that awareness in that moment that you are feeling overwhelmed or feeling sort of in a state of shock of whatever, the diagnosis or treatment plan that has come up, potentially a question, if it comes to you in that moment, could even be, I'm in a state of shock. I know I'll have questions later. If I do, is it okay? What's the best way for me to reach out to you?
Yeah, I love that. I love that. I think that's part of where I want patients to have some of those questions ready if they're able to. That's part of the idea of having that Amazon brain, like what questions can I ask? Or what's your number? Or what's my follow-up? And I think that's a great suggestion.
Thanks for that question, Wendy.
Yes, there's so much overlap in pediatrics and eye surgery. My wife and I compare this all the time. So it's stress response and fear and emotion about these two fields is very high, but it relates in a lot of medicine.
I know, Kapil, I just love that you take this so seriously, this patient caregiver relationship as you see it in your clinic, and want to, really make it better for people when they're in your office.
Yeah, I appreciate that. I think, being classically trained where I was, I feel like my mentors would be disappointed if we went down the slippery slope of the corporatization of medicine. So, standing tall for that and standing tall for the ideals and also for our patients, I think at our core, all physicians want that. I think sometimes physicians feel powerless on that slippery slope also. And I think empowered patients allow empowered physicians, allow empowered medicine. I want to start to transition some of that to the patients and the families because they have a ton of power here. And we just have to kind of guide them to it.
Yeah. And I'll share, as a patient, I've had to navigate a lot of, very difficult situations and conversations over the last few years, but I had to become very, I don't know, picky and choosy about who I would allow to come with me to the appointments. Because sometimes, even though people are really well-meaning and want to come, they can't control their emotions. And I know you touched on that a little bit, but I just knew it was in my best interest in that tender time with the doctor when I'm navigating my own emotions. I didn't want to have to help people with theirs, my caregivers. So I think that these honest conversations are very difficult if you have them, but I felt like it empowered my time with the doctor. And sometimes I went by myself because that was better.
Well, that's so good that you're able to, I think that's a testament to your self-awareness and what you need. You're taking that step to optimize that healthcare visit for yourself, and I think having the awareness, setting up that boundary, or you had your own little like mini internal huddle with yourself.
Yeah.
What's best for me? And I think Dr. Ajmani can probably relate to this. Sometimes little kids can't set their boundaries, or legally they're not allowed to have a boundary. Say mom and dad aren't coming. And then my elderly patients sometimes feel like they can't set that boundary. And some of that I think is their eyes are going to be dilated, the vision's poor. They're relying on them to actually be taken to the healthcare visit back and forth. and it's rude for me to say you're waiting out in the car. So there's a lot of that energy there that hampers their independence in the moment a little bit, and it doesn't have to be. It doesn't have to be. I think even that caregiver is well intentioned if you pause to have the conversation.
Yeah. Or like you said, I'm going to go into the doctor. Can you wait out here
Yeah.
in the waiting room? There's all kinds of ways around it, but I think it's hard. I think you have to do some internal work before you can get to that,
Yeah.
to
No, you're
have
right.
that
Yeah.
honest conversation. Yeah.
And
I think I had a lot of experience, navigating 3.5 years with Ben.
Yeah.
It was just, there were so many people that wanted to be there. And it just, once we figured it out, it was like, okay, this works.
Right. That's great. That's great.
And I think as you were sharing that, Wendy, the statement of, maybe asking a caregiver who wants to join you, can you wait in the waiting room? That also made me think of, in terms of the caregivers themselves, perhaps a way of offering support is, would you like me to come into the room with you, or would you prefer that I wait in the waiting room, or would you prefer that I wait in the car? And so offering that proactively as the caregiver as options, so it's kind of, so that the patient doesn't have to necessarily verbalize that 100% on their own. You're kind of presenting that to them. What will you be most comfortable with? I want to support you in whatever way you'll be most comfortable.
Yeah, that's a great idea. It adds that extra step of empowering everybody.
Mm-hmm. Yeah, because sometimes, like, let's say you have an aging patient come in that losing their vision, and maybe one child lives locally and can come to the office, and then there's 2 others that are out of state, let's just say. But having that, like you said, that Google Doc, or that way to communicate so everyone can feel like they're weighing in, even if they can't be there in person.
Yeah, I think that's huge. That energy plays out a lot. And I think somebody from out of town might come in for the first time and say, have a lot of mistrust. So why is mom still getting all these injections in her eye every month? And something must not be going on right here. And I read this online, and there's maybe an accusatory energy of a different sibling. And can that play out in the doctor? Yes. Is that the best to organize alignment? And I don't think so. I think it's better to kind of get aligned and say, here's my specific question about this one thing I read. I just want to make sure we're aligned here. I think that's better for everybody. I don't think it's great for mom to get worked up with that energy right before she gets her shot in her eye.
Yeah.
I think it's not a great energy.
Yeah. Well, Dr. Kapoor, thank you so much for sharing your insight with us on this caregiver series. Because we've, over the years, when I first started the foundation, we were very much focused about the patient. But over time, the feedback was, okay, but the caregivers need this too, and they need the guidance, because they're in it with the patients as well. These are such important conversations to be had, and I know they will go far. These lives will appear on our YouTube, so people can watch them later, and we can refer people to them. So, and Dr. Ajmani, she's a beautiful moderator, isn't she?
Yes, she is. I really enjoyed all of our chats and all the overlaps we had with our experiences. So that was a great summary, Wendy, and I had a lot of fun being on. So thanks for having me.